Good morning. I'm here with Ed Harrison of Pikes Peak Strategic Group, and we're going to discuss some of the new Ameriplan plans here. How you doing, Ed?
Good morning on this beautiful day in Colorado.
Oh, it is a beautiful day. And it's a great day to talk about healthcare and dental plans and things, isn't it?
Yes, and with the Affordable Care Act coming up, coming up in mid-November, I think it's a perfect time as we're going to get into October next week.
Yeah, and now when does the sign-up start? Is it November?
November 15th.
Okay, and when does it end?
I think it's December something. I can't remember exactly what the date is, but there'll be a lot of information coming out, and our state exchange has all that information on it to connect with Colorado.
Okay, and you can go to healthcare.gov too to find information.
Yeah, both of those. The state as well as the federal exchanges.
But the good news is, with anything with the Ameriplan discount plans, you can sign up for that anytime, correct?
Oh yes, and when I'm talking, Dan, with people who are really uninsured, not being an insurance agent, I don't talk about insurance at all, but I do talk to them about the 4 plans that the federal government is offering, the gold, platinum, silver, and bronze. And most people are going to be opting for the bronze, I hear, this year, because the prices are going to be coming down considerably from the insurance companies, that you have a low premium, monthly premium, but they're all going to pretty much, especially the bronze and silver, to probably $5,000 and $6,000 deductibles. That's where Ameriplan fits in, because the Affordable Care Act does not cover dental or vision, and we also, with our $49.95 program, we can help them with out-of-pocket expenses. So when I'm talking with people, I tell them to take a look at what we have here, and then I'll just direct them to the state, our state exchange, or to the federal exchange. That's all I do at that point. Then they can talk with a representative there, what they may decide to do based on their income and the subsidies from the government and all that other things that the government is providing people.
Okay, well, so it sounds like with the Affordable Care Act, or even any other insurance that you get, you might get the big deductible, and it'll cover you for the big stuff, but you still have a lot of expenses in between, and of course, most all of them don't cover dental or vision. So the Ameriplan plans here that we're looking at fill in pretty nicely, don't they?
Yes, and we can start off, Dan, with our flagship program, which is that Ameriplan Dental Plus.
Yeah.
Where you have dental, vision, prescription, and chiropractic services. And once again, as we're speaking to our audience, the Affordable Care Act, also known as Obamacare, does not cover dental or vision care, nor chiropractic services. You can get the prescription program, however, with the Affordable Care Act. But our dental program is just outstanding. It's the first program our company started with almost 23 years ago, and it's still going strong. It's about 80% of our revenue or business for our company, and it's just an outstanding program. It's a membership, a month-to-month membership, so there's really no long-term contracts that you get from, say, a competitor, who usually wants you to sign up for at least a year obligation with premiums and co-pays. So we're a membership program, just like Sam's Club or Costco Club. You sign up today, you can use the program today, and it's a month-to-month program.
Well, I like the fact that it's $19.95 for the entire household, and insurance, and which this is not, never covers an entire household, does it?
No. You might have a family, say that typically I'd like to use the family of 4. Normally you'll have one price if it's an individual, but for a family, for basic dental insurance, usually you're going to pay anywhere from, for a family of 4, probably anywhere from $60 to $110 a month for just dental coverage.
Definitely. And I like the Ameriplan is that there's no paperwork, there's no waiting period, and then there's no limits to the number of visits.
No, and that's where we stand out, Dan, with our program, is that many of the dental insurance companies, number one, you got co-pays, plus you got caps. So, and those are usually $1,200 to $1,500 per person in the household.
Mm-hmm.
And once that's exhausted, you have to wait till the following year to use that particular service. So with us in particular, we really get a lot of call for young people as well as adults who are interested in our braces program, and we're the only ones that provide through our wonderful dental program braces for young people as well as adults at a fraction of the price. So that is a big nugget out there for any future customers we have or people who are shopping around.
Absolutely, because insurance, and I'm not an insurance expert, but I've never seen insurance that covers braces, really.
No. Looks like we have Bernard back with us.
Do we have Bernard?
Yeah, I've got you at the bottom, but not in the middle.
Okay.
I'm in the big screen.
Okay, well, we got you on the big screen, and that's all that's important. So we're describing, we're talking about the Ameriplan Dental, is it Dental Plus?
Dental Plus.
Dental Plus here. We've gone through quite a bit of it. We haven't got to the vision part, which is interesting. 12,000 optical providers in the country and big chains where people shop.
That's correct. I just wanted to reiterate that we have over 75,000 dental providers throughout the country also, Dan.
Yeah, that's amazing. So you can go right to the Ameriplan website, or you can come to pikespeakstrategicgroup.com, and we'll have a link here that you can go search for a provider in your area.
Right.
But I was interested in the 25 to 80% savings on dental procedures.
Well, that's really outstanding. There's not too many other companies in the market that measures up to what we're doing for our fellow Americans.
Oh yeah, for $19.95 a month. Now we get down to the prescription, and I shop at Walgreens, so this is nice to see the name here.
Yes.
So
we have over 56,000 retail pharmacies, big chains, as well as the maybe small mom and pops that are still out there that accept our prescription program.
Okay, and that's kind of interesting because that's another thing that that is expensive and probably not covered through most insurance, especially the big deductible insurance programs. Is that true, you think?
Yes, that could be the case because as you go through those 4 programs through the Affordable Care Act, the Platinum, Gold, Silver, and Bronze, as we spoke about, and people will be getting a lot of information on that coming up in the next few weeks. There's different types of prescription programs, so you have to be able to shop for your prescriptions. And being a member of Ameriplan, we have a special site that you can go to, and you can make comparisons on different prescriptions. So when you're shopping around, you can go to Walmart or Walgreens or CVS, and they will, based on the information you get on our screen through our portal screen, you can shop around for the best prescription price. So in your immediate area. So
and that's for members only?
Pardon me?
Members only?
Yes, you have to be a member.
Okay.
And set up a portal. So there's just a lot of information, and Bernard and I try to sit down with new members and give them the information. It's also in the small pamphlet that comes in the mail with their membership. So we encourage everyone, before they do anything, is maybe take 15, 20 minutes and go through that pamphlet, and if they have questions, to give one of us a call. So, we either can talk with them over the phone, email, or have a one-on-one with them.
Okay, that makes perfect sense. And you guys are always available for phone calls and email, correct?
Correct.
Okay. Now, Bernard, I was going to ask you about the programs here. We've got the 4 programs, and I think essentially as you go from left to right, each one includes the former's benefits plus a few. Is that basically true?
Yes, it is.
Okay. Well, let's talk about the MD Plus here, shall we? So it's
Okay.
$29.95 for the entire household, and I'm
That's
seeing
correct.
a 24-hour access to a doctor by phone or email. How does that work?
How that works is you have to log in and or call for the service. If a doctor is not immediately available, they will let you know when the doctor will call you back. You also have the ability to look at the doctor like we're doing on the computer and discuss your issues. It is extremely secure and safe, and you're talking to a licensed medical physician, not a nurse. And I'm not saying anything's wrong with nurses, but nurses have to confer with a doctor, but you got the doctor right there. They have just recently updated the program, and if you're asking a what-if question or a consultation, now those are free. If it's a diagnostic call, then it's $17.95 per call. Now, there is some history there of one member using this service 4 or 5 times in a very short period of time. No issues, no questions. It's there for our members to use.
So this is really cutting-edge stuff here is what I'm seeing, where you can actually get a hold of a medical professional, a doctor, and ask questions or even get a diagnosis, which is, I mean, insurance companies almost never offer that. You got to get dressed. If you're sick, you got to go to the doctor. You got to wait in the waiting room. But with the Ameriplan MD Plus and the Ameridoc, if you're a mother with 3 kids, you don't have to bundle everybody up and run into the doctor if somebody gets sick, do you?
Actually, what you're saying is 100% true. However, insurance companies do have a similar program, but they charge twice as much. They charge upwards of $40 per call.
Wow.
With Ameriplan, it is $17.95, period.
Per call for a diagnosis.
Yes.
Wow, that is truly...
And the doctor can prescribe medication for you and send it to the nearest pharmacy closest to your location, which means if you're traveling, say you're in Texas or New York, you don't have to be at home to use this service. It goes with you. And
the prescription can be sent to some of these small companies, right, like CVS, Walmart, Target, and Walgreens?
Absolutely.
Well, they're not actually small.
Military, yep. And if you're in the military, they can send it to a military pharmacy as well.
Okay. So really, I mean, there's no way that you're going to suffer like if you're even out on the road in some podunk town, because chances are there's probably a Walmart within 20, 30 miles of you, I would guess.
Absolutely. Absolutely.
And they can send the prescription right there. And it sounds like through the Ameriplan MD Plus, the dental is also included, which is similar to the Ameriplan Dental Plus, right?
Yes.
Which we discussed. So this sounds like a great deal. Now the next one, the next jump up is the Ameriplan Healthcare.
Oh, Dan, if I may interject for a minute, in the MD Plus, also in that package, you get the hospital advocacy program.
Oh.
Forget that. There's 4 programs in that $29.95 program.
You're right. We didn't discuss that.
So if you have a bill that's $2,500 or more, our member can team up with one of our advocates that will negotiate their bill at a particular hospital throughout the country. So that hospital advocacy program is part of that $29.95 program. So you have really 4 programs: the Ameridoc telemedicine, you have the advocacy program, you have the prescription program, and you have the Dental Plus. So that is really an upgrade as of July 14th that our great company has come up with to help our clients out there. So I didn't want us to be remiss and forget about the hospital advocacy program that's in that $29.95.
Absolutely.
Yeah, that's a big deal. I mean, both of these here, the Ameridoc and the hospital advocacy, are very individualized programs, aren't they?
Correct.
And they'll actually go through your hospital bill with you.
Yes.
and work on that and make sure, kind of rationalize and I guess make sure that you're getting what you think you were getting, and do they help negotiate to lower the cost maybe?
Yes, they do, and that's all based on what your income level is, and you will have that advocate and or counselor with you throughout the process, and they can go through the hospital jargon and the medical language, which the average person, you and I, wouldn't know what they're talking about.
So you don't go it alone, do you?
No, that's the great thing about this.
Okay, I like that idea. So I mean, it's $29.95 a month, under $30 a month, and you actually get somebody a person, not a computer, who will actually go through this with you.
Personal contact.
Yeah, and that makes the big difference, I think, to a lot of folks.
Right.
Well, let's go back to the Ameriplan Health.
Yeah.
So the extra benefits for Ameriplan Health are, let's see, includes, and you get some extra programs here.
Yeah, you get everything in the Dental Plus as well as the MD Plus are all included in our $49.95 program, which also includes podiatry and labs, and so you get our total package there. All the medical things that we just spoke about, Bedard and I, are in that $49.95 package.
And it looks like the extra stuff here is hearing problems or hearing discounts for folks with ear problems.
Yes, and that's where we can help our seniors, because if you look at Medicare program, they do not cover hearing in their basic Medicare program. So I just was looking at that in the manual the other day. I just got a copy of the manual, and I was going through there. Hearing aids are not covered. Neither is dental. Neither is vision. So this is something that we could help our seniors with some of these discounts that we can get on hearing aids. Hearing aids can be very expensive.
Well, yeah, hearing aids and dentures and braces, those are big dollar items that are hardly ever covered in any insurance.
Exactly.
And so, interesting enough, there's 40% savings on hearing aids, because I know hearing aids cost $2,000, $3,000, $4,000 for a set.
Easily.
So if you're saving 40%, I mean, that'll more than pay for the $49.95 per month for a very long time.
Yes.
So I'm seeing some other things here: physical therapy, laboratory procedures, and diabetic supplies, which is kind of interesting.
Yes. As a member, if you're a member in either one of our medical programs, you can get involved in our online diabetic supply program, and that's outlined in our brochure and in the booklet that comes in the mail. Or that person can email or give Bernard and I or one of our associates a call, and we can explain to them how the diabetic plan works, supply works.
So if you have diabetes and you're buying this stuff on a regular basis, why not get a discount?
There you go. Correct, Dan.
And if anybody has questions, I just want to reiterate here. Here's the phone number, 855-878-7774, if there's any questions. Because this is a lot of information here, but of course you guys can simplify it.
Yeah, we like to sit down with each member as they come on, and we also encourage them to read the booklet. I know I've said that 3 or 4 times, but we get a lot of members who come on, and they might get the cards and run out to the dentist, but they really need to take a few minutes to read over that booklet, because it has valuable information on how all the programs work, what to expect when you go into a doctor or dentist, what you have to pay, and what and so forth, because we're different from insurance, so we don't get involved in making payments to the insurance company. Once you get the discount there with the dentist, you pay whatever the dentist has contracted with the Ameriplan, or if it's a larger ticket item, that dentists could possibly set up a payment program, especially for our braces, which are, you can say 50 to 60% on our braces, and you might have a balance maybe of $1,500, $2,000, and you might be able to get that financed for a year and a half or 2 for $50 a month. But you still can saving considerable money on the braces, because the average bracing of people costs about $6,200.
Correct. So I was looking at the Ameriplan is the lifestyle here, and so just kind of going back and covering everything here. The lifestyle will include everything that we've covered previously, with some extras here. Correct?
That's correct.
Absolutely.
Go ahead, Bernard.
Yeah, the lifestyle program for better terms, the benefit plan up to and including personal services that will benefit households and families. ID protection, a legal plan. You get a free will. You get credit and repair, business and technology for students, travel, dining, recreation, shopping, and if you have kids, we have one of the foremost child ID programs in the nation. This is just an absolute incredible plan for $99.95 a month.
Well, you said something about a will, and I know that the wills are anywhere from $1,000 to $2,500 per will.
Yes.
I mean, you'd be silly not to take advantage of that. I mean, you'd pay for the program for a year easy.
Exactly. And this is what we're trying to get across to folks.
Okay, and I can see some extra stuff here. There's car rental discounts, condos and resorts, golf, home and garden, all kinds of stuff. And
typically, when I go for golf on a 9-hole course, everybody else pays $35. I show my Ameriplan benefit card. I pay $18.
So you're getting it half price where you go?
Exactly.
Your golf? How many times do you golf a year?
I don't do it as much as I used to, but I do it just to see the look on people's face.
Well, say if you were an avid golfer and maybe you'd golf once a week for, I don't know, what do you think, 12, 15 weeks out of the year? So that's almost $20 times 15. So let's see.
You pay for your program. Yep.
Yeah, just with the golf discount alone. I mean, and I'm sure you would use all the other things here too. So it looks like that this is probably one of the best bargains here you can do, the lifestyle.
Well, and I want to put some icing on the cake for folks. I got an email last night that was sent to hundreds of thousands of Americans. USAA, an incredible company, been around for years. They have now started offering vision care.
Oh.
Vision care of individual plus and family. The price of family, the cost of our health care plan alone. So it shows you how good we are. You're going to pay more for just their vision plan than you will for our entire health care plan.
For the entire, you're talking about the lifestyle plan?
Yes. No. The health care plan. The $49.95 health care plan.
Okay. So if you were to go ahead and if you're covered by that insurance company, you would be paying more for just the basic, what is it, vision care?
Yes, nothing but vision.
Nothing but vision.
No anything, just vision.
Well, how do we get the word out that that's probably not the greatest deal you can get?
Well, again, folks sometimes have to scrape a knee to understand that there's a better way, but the Ameriplan Corporation and their 4 plans are just the best kept secret that we want everybody to know about. We're working very hard to get that word out.
Let's not keep it a secret anymore. People can go to the website.
Absolutely.
which is pikespeakstrategicgroup.com, and there's also a phone number they can call to get a personal attention with questions here, 855-878-7774. So what have we missed here?
I think we've covered it pretty well, Dan.
Yep.
The highlights. Yep. We don't like to overwhelm people with a tremendous amount of information, but we just want to give them an outline of our healthcare programs along with our non-healthcare programs that can help families throughout the country. And we want people to take a strong look at this wonderful company called Ameriplan USA. And once again, we encourage people to go to our website, pikespeakstrategicgroup.com, and or our phone number at 855, toll-free 855-878-7774, and leave us an email, or you see something you like, especially with that dental program with your young kids, you can sign up that day and use the program that day. That's what makes us different from the dental insurance companies. Many times you have to wait for a period of time before you can get that dental, and sometimes if you got a crown or a cavity or something, you don't want to wait till the next day. You want to see a dentist today.
Absolutely, and why should you pay full price when you can get a great discount here, plus all the other benefits that come with the programs?
Correct.
Well,
there you go.
Bernard, is there anything I've forgotten here?
No, I think you've covered it extremely well, and we need to get folks to look at our website, and if they have questions, give us a call so we can get them in the program.
All right, I think we've done a good job this morning. I want to thank you guys for spending some time here. I really appreciate it.
Okay, thank you, Dan.
Thank you, Bernard. You guys have a great day, and we will see you next week, correct?
Yes.